Absolutely. It is a negotiation, a cooperation between Congress and the administration for deciding where the research needs of how to best meet the research needs of the country.
2/3 of all the people that are on Medicare have 2 or more chronic illnesses. We spend 93% of the money in Medicare on those 2/3 of the individuals. They're suffering. I don't think we can do that without integrating AI into this process. And I think we're on the verge of actually doing a lot of that today.
Welcome back to MAGA Capital, the channel where we bring you the truth, the facts, and the opinions that mainstream media doesn't want you to hear. If you love your country, if you believe in freedom, and if you're tired of bureaucratic nonsense, make sure to hit that like button and subscribe to our channel. Ring the bell so you don't miss any of our updates. Let's dive into today's video where we break down an important discussion from Capitol Hill about NIH funding, AI, chronic illnesses, and how this all ties into the future of our great nation. So, Senator Rounds had an enlightening discussion with Dr. Bachiria, and let me tell you, there's a lot to unpack here. The first thing that stood out to me was the focus on smaller institutions getting a fair slice of the NIH funding pie. Finally, someone's talking about fairness and efficiency. Smaller institutions often have lower overhead costs, which means more of that money can go directly to research and innovation. That's how taxpayer dollars should be spent, on results, not on bloated bureaucracy. This is a prime example of why we, the people, need to hold Congress accountable for how they allocate funds. Now let's talk about what Senator Rounds said about chronic illnesses and Medicare. Did you know that 2/3 of Medicare beneficiaries have 2 or more chronic illnesses? And get this, 93% of Medicare spending goes to those patients. That's nearly all of it. Imagine the impact if we could use modern technology like AI to improve their quality of life while saving taxpayer dollars. It's a win-win situation. This is the kind of forward-thinking approach we need in government, not the endless red tape and inefficiency we've grown used to seeing. Let's watch the full Senate hearing, and I'll be giving my full response and reaction afterwards.
Thank you. Senator Rounds.
Thank you, Madam Chair. Dr. Bhattacharya, first of all, I enjoyed our conversation last week. I do think there is a real value in looking at smaller institutions as well and providing an opportunity for them to participate and compete for the grant dollars coming out of NIH. And I think you may very well find that their overhead may be substantially less. I also think, just in terms of being fair, I think we've got to do perhaps a clearer job of understanding as to what would be considered direct or indirect costs and lay that out with regard to whether or not it's overhead or something that's needed. If a smaller institution has the need for a centralized, larger computer system, and that's a larger part of what's considered overhead, it may very well mean that that's a larger part of what they're going to be spending their money on, but it might be a very important part of an experiment. Is that a fair way of looking at it?
Absolutely, Senator.
Okay. Look, I think what you're hearing today is in a number of areas. First of all, that by tradition, a president would suggest a budget and then a Congress would modify it back and forth. What I think we're assuming is that in this particular case, the president's budget has said this is the very basic minimum. Congress, if you're going to authorize stuff, you're also going to be accountable for actually appropriating the money. And so the expectation is, even more than a negotiation, is that we will be expected to put the money where we think it is best. And when we do that with an appropriate authorization, you will follow the law and you will see that the money is spent in those appropriate locations. But it will be up to us, once again, to reassume the responsibility we've got for actually deciding and telling the American people we want to spend the dollar in the following areas. Is that what you're sharing with this committee today?
Absolutely. It is a negotiation, a cooperation between Congress and the administration for deciding where the research needs of how to best meet the research needs of the country.
I'm convinced that there's an opportunity to do two things at the same time, and sometimes I think it's misunderstood in terms of how we approach spending money, and that is just as an example, in Medicare, 2/3 of all the people that are on Medicare have 2 or more chronic illnesses. We spend 93% of the money in Medicare on those 2/3 of the individuals. They're suffering. Their quality of life is not good with 2 or more chronic illnesses. If we can find a way to improve their quality of life and actually save tax dollars by addressing those chronic illnesses, whether it be diabetes, whether it be Alzheimer's, whether it be Parkinson's, or cancer, it's kind of a win-win situation, isn't it?
Absolutely, Senator.
I don't think we can do that without integrating AI into this process. And I think we're on the verge of actually doing a lot of that today. But part of it requires databases. Let me work my way through this just a little bit. I think we have to invest in modernized data systems, including leveraging AI to accelerate research, maintain global leadership in life sciences, and develop treatments and cures for both chronic and rare diseases. As a co-chair of the Senate AI caucus, I'm one of the individuals who have championed several pieces of bipartisan legislation. This is bipartisan in nature, to expand AI literacy, adoption, and competitiveness. Now, I've been briefed on the National Center for Advancing Translational Sciences, known as NCATS, and their work on N3C. I'm impressed by its success and its role in supporting the National AI Research, or NAIR pilot. However, under the budget, I noticed that NCATS will be folded into the National Institute of General Medical Sciences. How will NIH's proposed consolidation strengthen NCATS leadership in data science, AI, and machine learning?
So I also am tremendously proud of NCATS and what it's accomplished in AI. I'm also aware of the program you're talking about, where my predecessor, Director Bertinoli, she developed this program. I fully support using NCATS to address the needs you're talking about. To me, the most important thing isn't the exact organization of but rather the actual activities that we do. And under whatever reorganization we do, of course, Congress will have its say. I want to make sure that those activities go forward, because I agree with you, Senator. The investments that we make in AI will pay off dividends enormously. It's a tremendously promising way to do scientific discovery and also to make patient care experiences and physician-doctor relationships much better, and better diagnoses, better ways to manage patients and to prevent illness. I think AI is going to play a real important role in all of that.
I think the next step will be literally incorporating AI as an agentizer in the development of multiple types of approaches to solving lots of these chronic illnesses. And I am very hopeful. This is not something that's going to take decades. It may take years, but this is an opportunity to really show an improvement in quality of life that impacts American families, not just the individuals that have those chronic illnesses, but those who take care of them as well. I look forward to working with you, sir.
Likewise, Senator.
Thank you.
Speaking of AI, let's address the elephant in the room. The National Center for Advancing Translational Sciences, or NCATS. Senator Rounds brought up a fantastic point about the importance of this program in advancing AI and machine learning to tackle chronic and rare diseases. But here's where it gets murky. Under the proposed NIH budget, NCATS will be folded into another institute. Now, let me ask you this. Why would we consolidate a program that has already proven its success in groundbreaking AI research? This is why we need strong leaders in Congress who will fight to ensure our tax dollars are spent wisely. And let's not overlook the bigger picture here. AI is the future, plain and simple. It has the potential to revolutionize healthcare, improve patient outcomes, and even strengthen our position as a global leader in life sciences. But here's the thing. AI isn't just about technology. It's about American innovation, ingenuity, and the spirit of competition. We cannot afford to fall behind countries like China, who are pouring billions into AI research. The moment we lose our edge, we lose our ability to lead the world. That's why the investments Senator Rounds is talking about are so critical. Now, I want to touch on a point that really hit home for me. Senator Rounds mentioned how AI could improve not just the lives of those with chronic illnesses, but also the lives of their caregivers. That's huge. Families across America are struggling to take care of loved ones with diseases like Alzheimer's, Parkinson's, and cancer. These aren't just statistics. They're real people with real stories. If AI can help alleviate some of that burden, we owe it to them to make it happen. And let's not forget what this all boils down to: freedom. The freedom to innovate, the freedom to compete, and the freedom to live a better life. That's what this country is all about. But freedom doesn't come for free. It requires bold leadership, smart decisions, and the courage to stand up for what's right. That's exactly what Senator Rounds is doing, and we need more leaders like him in Washington. So what can you do? First, stay informed. Share this video with your friends, family, and anyone who cares about the future of our country. Second, hold your representatives accountable. Let them know you support smart investments in AI, healthcare, and American innovation. And third, don't forget to like this video, subscribe to MAGA Capital, and ring that bell so you don't miss any of our updates. We're living in a pivotal moment in history, folks. The decisions we make today will shape the future of our nation for generations to come. Let's make sure we're on the right side of history. Thank you for watching. And as always, God bless America.